trimester of pregnancy, but when I was in my second trimester of pregnancy, I contracted COVID. And in terms of symptoms, I had extremely high fever, which made me and my husband worry about how this may impact the unborn child or the fetus. So we immediately tried to contact a hospital, but they were not ready to take me in. Fortunately, I kind of recovered quickly and didn't have very serious complications. But that prompted me to really look at the state of pregnant women in India and how the COVID wave or the second wave of COVID has hit them. So for me, that was extremely crucial, and I felt that I had to do something. And so I started a petition directed to the health minister on change.org. And as soon as we got the backing of more than 70 to 75,000 people, most of them pregnant women and either family or friends of pregnant women backing this petition that vaccinations for pregnant women should be opened in India, the next step for me was to approach the court. So I filed a writ petition in the Delhi High Court seeking guidelines from the court so that vaccinations could be opened up to pregnant women in India. As a journalist, I started interviewing other pregnant women or families of pregnant women who were hit during the second wave of COVID. And what I found out was really shocking. What I found was that a lot of pregnant women had actually gone into preterm labor after contracting COVID. A lot of them had been they had severe complications, and they were trying to access hospital and facilities but were turned away. Some of them were hospitalized, and some of them also died. In some cases, both the mother and the unborn child died. So the obvious solution to this was, how do we protect this extremely vulnerable and at high risk population of pregnant women? vaccinating pregnant women with the COVID-19 vaccine is obviously the first step of protecting pregnant women during the pandemic, but that's not the only step. Even once that happens, a lot more needs to be done. Pregnant women cannot stand in crowded vaccination centers waiting to get themselves vaccinated. They are at high risk of exposure, and if they get exposed to COVID-19, they're at high risk of mortality. So that's something that the government needs to take care of. There should be special centers that should be created only for pregnant mothers and lactating women to go and get vaccinated, so that their risk of exposure is very less. The second thing I think which is very important to do is to ensure that there's enough data being collected around how the vaccines are impacting pregnant women. That's something which has been totally missing. The third thing which we have to do is hospitals should not be turning away pregnant women who are COVID positive. From my reporting, I've seen that when pregnant women try to go to a COVID hospital, they are turned away. When pregnant women who are COVID positive try to go to a COVID hospital, they're turned away saying that they should go to a maternity hospital. When they try to go to a maternity hospital, the maternity hospital turns them away saying that we cannot take COVID patients. So in this game of to and fro from one hospital to another, a lot of them have become very serious. A lot of them have also succumbed to COVID-19. So there should be guidelines specifically by the Government of India, by the Health Ministry, to ensure that hospitals and healthcare providers do not turn away pregnant women who are COVID positive and attend to them immediately.